Okay. Hello, everybody. I'm sorry we're a little bit late. We had some technical difficulties, but we are here now, coming to you live to talk a little bit about labor and delivery at Lakeland Regional Health. I am April Mucci with Lakeland Mom, and with me today I have Lori Shea. She is the Associate Vice President of Women's and Children's Services at Lakeland Regional Health. So, hello, Lori. Great to see you. Thank you for joining me today.
Thank you.
We're going to talk about pregnancy and labor and delivery right now during the coronavirus pandemic. We have a lot of moms to be in the Lakeland Mom community, and we know some of them might be anxious right now, and understandably so. But I know from staying in touch with you guys, which we are thrilled to have Lakeland Regional as a Lakeland Mom partner and sponsor, but I've been keeping track kind of what the hospital and Lakeland Regional Health has been doing. You obviously have been at the forefront of keeping our community safe and keeping patients separated from those who have coronavirus symptoms. You have the respiratory care center, you've implemented a telehealth call ahead service for the emergency department, just to name a few things. So I think it's really important that people realize everything you're doing, pregnancy or not, to keep patients separated. So if you're watching live and have a question, we will do our best to answer it. If we don't answer it during the live broadcast, we will try to get you an answer after the fact. But with that, we're going to get started. And if you, Lori, would just kind of start at the beginning with when moms arrive for labor and delivery, kind of where they should go, if that has changed, and what they can expect when they arrive at Lakeland Regional.
Great. Thanks so much, April. And I am just absolutely thrilled to be with you all today, and just looking forward to getting to know many of our moms out there in Lakeland. But yeah, the leadership at Lakeland Regional has been working tirelessly for the past probably month and a half, just to ensure the safety of all of our patients at Lakeland Regional, and specifically in our Women's and Children's Pavilion. So, some of those questions that mothers will have and labor support people will have is, first and foremost, I think some of the things that we've heard is, are we open or are we closed? And I can verify without a doubt, we are here to serve you. We are here to protect you. We're here for your safety, and we are certainly open. All of our operations are open 24/7 in the Women's and Children's Pavilion. All of our COVID patients are in the medical center and in a separate department, and as well as when they do come through the ED, they are in a separate department. So again, lots of planning, lots of diligent work around keeping patients safe, and also the information that has come out on the Lakeland Regional website and the CDC. We keep up to date on that. So those are good resources for patients and pregnant moms to have. Right. So one of those things, go ahead.
In case people haven't been to visit for some reason, the labor and delivery and the Women's Pavilion is a completely separate building from the rest of the Lakeland Regional campus.
Absolutely.
Okay.
It is. We're in a beautiful new tower that hosts both pediatric units, labor and delivery, our level 3 NICU, our pediatric specific emergency room is separated from our adult emergency room, as well as we have high risk obstetrics for MFM services in that building. And all of the services that would coincide with Women's and Children's. And we do have a partner with the Moores, with our specialist, and they too are open and seeing patients, in their clinic in an outpatient perspective. So again, if you are arriving on the Lakeland Regional campus, you'll want to park in the DE parking garage. That is really the best place to kind of walk right into the Women's and Children's Pavilion. You'll be greeted by some of our team members there. They will be taking your temperature. They take all of our staff members' temperature as well. That's one of the initiatives that our leadership has put in place over the past couple of weeks to ensure the safety of those parents that are coming in, future parents coming in, current parents coming in, is all of our team members have their temperature taken. That includes anyone from frontline staff to those people who are instrumental in helping all of the services run in our organization. So we get our temperature taken. Most recently, we are doing a distribution of masks. Those masks will go to every employee and every visitor who enters into our facility. So you will obtain that. Some of the things that you've also heard is that Lakeland Regional has really been focused on our visitor policy. And we are so focused on ensuring that moms receive that one-on-one care, and that we're focused on your experience in labor and delivery. So our visitor policy right now is one labor support person can accompany you for the entire duration of your visit, labor and delivery, postpartum. And we ask that during COVID, that labor support person remain the same person. But, you know, we're really, as soon as we have the ability to lift those restrictions, we all know that we will welcome back those families to be able to celebrate those times with you. We also are asking that, you know, once the baby's born, we will facilitate in any way through your platform to be able to have FaceTime and different platforms so that family at home can be able to share in that birth as well.
Okay. I know I've seen some creative birth announcements and ways people have figured out new ways to connect with their families after giving birth and show off their new additions. So I'm sure that will continue as we're limited during this time out of safety needs. So
absolutely.
So obviously the visitation policy is really the biggest change. You know, I think people are nervous about what to expect, and from talking with you and others, that obviously is I think the biggest one, in addition to all the safety precautions, the hand washing and the social distancing as much as you can in a medical facility. So what other, let's, I guess, back up a little and talk about just pregnancy in general. What kind of precautions pregnant women should be taking right now? If it's any different than
that's a great question. I think that they should be taking the same precautions that everybody should be taking at this point. So real important to have great hand hygiene, continuously washing your hands, not touching your face. And if you do touch your face, making sure that you wash your hands immediately after, because that's where some of the ability for, COVID-19 and other contagious processes to be transmitted. The other thing is just making sure that you're social distancing. That has really, I believe, statistics have shown that it is decreased the transmission of COVID-19. And more importantly, if you have been exposed to COVID-19, please contact your OBGYN provider immediately. And that is an OBGYN or your nurse midwife, whoever is caring for you, and they really can help walk you through that journey and minimize those anxieties.
Gotcha. Speaking of OBGYNs and midwives and providers, that I think is another anxiety is for all of us in general, as far as going to the doctor right now, not making any unnecessary visits to any medical facility unless we need to, which on the one hand, there have been a few stories lately about Lakeland Regional and people avoiding care out of fear. And I know that's, you guys have come out and said how important it is that people not delay care, especially if it might be emergency care. That, again, what we talked about earlier, what an effort you've made to separate people with coronavirus symptoms from other things. So we want to help spread that word to the community at large that please seek care when you need care. But specifically to women who are pregnant and um, needing to still see their OBGYN, can you address that a little bit as far as why that's still important and what they should be doing in that regard?
Absolutely. So a couple of things to that, April. It's really important that you're staying in contact with your OB provider, be it a physician or nurse midwife in the community, and communicating with them about what your prenatal visits look like and not missing those visits, because they really are the importance of making sure that you as a mom are healthy and the baby is healthy and leading up to a healthy delivery for both of you. So that's really important, both during COVID and a part of COVID. You know, prenatal visits are so important, you know, in the success of that healthy delivery with mom and baby. The other thing that is important is your care provider will you know, provide you with any education that you may need. And if you feel that you are having an emergency situation, we have what is deemed as an OBED. It's our triage area. It's located on the third floor of the Pavilion. This is an area where you will be met with very, very experienced nurses. We have an OB hospitalist on site 24/7, and an OB hospitalist is an OBGYN who is board certified and makes their practice in the hospital. So they don't see outpatient, they're only in the hospital. And you can see them, or your provider that you go to see will meet you in our OBED to evaluate you. In addition to that, we have nurse midwives. We have a nurse midwife that works in tandem with our OB hospitalist, working 24 hours, 7 days a week. And we have OB anesthesia that's here in-house 24 hours a day, seven days a week.
Okay. I smile when you mention the OBED because when I had my second child, I came in as an emergency and needed it, and they were amazing in a time when I was very scared and very anxious. So you have some amazing staff there.
We absolutely do. We absolutely do.
One question, and I don't know if you can answer it now or not, it's something I hadn't thought of. If someone has a visitor with them, their birth partner, their spouse, significant other, can that person leave and come back into the hospital while they're visiting, or do they need to be prepared to stay the entire time?
As long as the partner or husband, significant other does not have a fever, a cough, shortness of breath, any of those guidelines according to CDC and what we're monitoring as well, they may come and go. Again, they'll be greeted with getting their temperature taken. They'll be asked those questions again. Do you have any of these symptoms? Have you been exposed to anyone who has COVID-19? And we would just ask, as we focus on your safety, thank you for being patient with us as we ask you those questions multiple times. It may seem repetitive, and it may seem as if we don't know what we're doing, but again, that is really our focus on your safety.
Right, absolutely, and we all appreciate that. All the precautions you're taking. Really quick, we're almost done, but one other question, as far as the Women's Pavilion and the Children's Emergency Room, for parents who maybe need to come back soon after birth for jaundice, or I know mine had RSV pretty quickly, anything that might happen that requires someone to come back to the hospital. Can you talk just a little about the Children's Emergency Department? And also, I know you have a call ahead service, if you can address that a little bit too, how that works.
Sure, absolutely. So if after the baby is born, for any circumstance, we need to see the baby back for a checkup for any reason, whether it be a circumcision or whether we need to do some blood work on the baby, we will coordinate that with you prior to discharge to let you know when to come back, where to come back to. We do have a pediatric ED. We're asking some of our families to come into the pediatric ED entrance so that you can be screened with those questions appropriately, and they can help guide to get you where you need to go to. Do you need to go back to, do you need a physician to come down to see your baby to check on the circumcision? Do you need to go up to the unit for anything? And they'll kind of help guide and direct that. But we will coordinate that with you post-discharge. Now, let's say it wasn't a planned situation, and like you had mentioned, your child got RSV. Certainly, our staff is here 24/7 to care for you and your child. One of the things that we are continuing to do is allow both parents in on the pediatric unit as well as NICU if your child does need to have a NICU stay or a pediatric stay. We feel it's really important, to make sure that we're partnering with you in the care of your child, and we want to try to, facilitate that as much as possible, and hoping that we get through this COVID and we won't have to put any more restrictions on.
Right. I know parents appreciate that. Obviously, if a child is in the hospital for any reason, it would be incredibly hard to be apart. So we appreciate you making that possible when it's needed. Where can people get future updates? If there are changes to your visitation policy or anything else, what's the best source?
So there's a couple of sources. Our marketing department has done a great job of keeping up with mylrh.org. And that has up-to-date visitation policies if there's any changes. Social media is a great site as well. Make sure that you like Lakeland Regional on Facebook and Instagram, as well as Lakeland Mom, so that you can get those updates. I got a good plug for you there. So ensuring that we have those updates for you. And then, of course, anything pertaining to COVID-19, we are closely monitoring the CDC.org and our state and local governments and what their recommendations are, and making sure that we are in alignment with that, and really focusing on the safety of our new moms to be, and celebrating this wonderful time.
Gotcha. Well, I appreciate you joining me today. Let me check and see if we have any questions.
Great.
Let's see. I know your social media team is great, doing a great job responding to people as well. I think that we've pretty much covered most of the big questions. And if anybody's watching this after the fact and you have a question, please leave us a comment and we will do our best to get you an answer. I know that you ask and we ask that everybody is patient and understands that these are unprecedented times, and all of our number one priority is to keep our community safe, to keep pregnant moms safe, to keep all the visitors that are coming to Lakeland Regional safe. So while things might be inconvenient and repetitive, we appreciate everything you're doing. So thank you, Lori. I appreciate you joining me today. Any other thoughts?
Yeah, just a couple of other thoughts. I just wanted to give a shout out to all of the team members in the Women's and Children's Pavilion. They have been working hard on making sure that their education is up to date and comfortable, so that we can really focus on our patients and focus on their safety. So I just want to send a thank you out to them for all of the work they're doing. And in addition, something I failed to mention with our ED and our pediatric side of things is Lakeland Regional has actually implemented a telehealth program. And if you need telehealth services, you can call 863-284-5000. And many of our providers are on there and willing to be able to provide a consultation for you. If you're not sure if you need to take the baby back to the hospital, that might be the good first step. And then they can kind of direct you on where we need to go. But Again, April, thank you so much for hosting this. I hope that this has been helpful for our new moms in Lakeland, and I look forward to meeting many of you as I do my rounding, and look forward to doing some more education and some highlights about our Women's and Children's Pavilion here at Lakeland Regional.
Absolutely. Thank you so much. Thank you guys who joined us live, and stay in touch. We'll have more useful information for you on
Thanks.
Lakeland Mom.